Hi friends, welcome to Smile Nursing tutorial. Today we are going to see the questions and answers in management of newborn. First question is, what is bonding? You have to say the answer. Okay, we'll count now. 1, 2, 3. Answer is effective bond between mother and neonate. Next, second question. Bonding encourages for what? Counts 1, 2, 3. Answer is maternal attachment with includes gazing at, kissing, fondling, holding the infant. Next, third question. What is rooming in? 1, 2, 3. Answer is if mother is fit and body is kept in cot beside of mother. Next, fourth question. Indication of rooming in. 1, 2, 3. Answer is increase mother-child bonding. Next, infection of the eye is treated by 1, 2, 3. Answer is silver nitrate drops. Next question. The nurse should count the respiration for 1, 2, 3. Answer is 60 seconds. Next question. To obtain a correct Abgar score, which assessment criteria are used? 1, 2, 3. Answer is heart rate, respiratory effort, muscle tone, reflex irritability and color. Next, the heart rate of a newborn at birth is 1, 2, 3. Answer is 150 to 180 beats per minute. Next, immediately after birth, the hands and feet become bluish, which is called 1, 2, 3. Answer is acrocyanosis. Next question. A prophylactic injection is given to prevent neonatal hemorrhage. 1, 2, 3. Answer is vitamin K. Next, abdomen is examined in the baby for defects like what? 1, 2, 3. Answer is abdominal distension. Next, bulging frontal is due to dash. 1, 2, 3. Answer is hydrocephalus, raised ICP. Next, normal temperature maintained for a newborn is dash. Answer is 36.1 degree centigrade or 97 degree Fahrenheit. Infection of the eye is caused by dash. Answer is gonococci organism. Next, skin infections are caused by dash. Answer is maternal infections. Next, Mongolian spots disappear by dash. Answer is 4 years of age. Next, sore buttocks are treated by dash. Answer is massaging and powdering. Next, the normal pulse of newborn baby is dash. Answer is 110 beats per minute. What is Abgar? Answer is appearance, pulse, grimace, activity and respiration. Next question is, bluish color spots are often seen on buttocks, back or thighs called as dash. Answer is Mongolian spots. Next, adequate antenatal care is given with dash. Answer is iron and folic acid supplementation.